Our first lecture, I'm going to ask you to take notes because this is all the information that is going to be on your exam. Everything that I lecture is the information that you're going to be tested on. And first we're just going to start with anatomy and physiology terminology. The definition of anatomy is the study of the structure, and the definition of physiology is the study of the function. And this particular class that you're taking is human anatomy and physiology. So you're studying in particular the anatomy of the human body and the physiology of the human. And there is a saying that the structure determines the function. And so this is why we teach these subjects together, anatomy and physiology, is because the anatomy determines the physiology. Structure determines function. And so most of the time, I will start my lecture teaching lab. I'll start with the anatomy and then explain the physiology most of the time, almost always. And we have to kind of start from the bottom of this levels of organization. You have to work our way up to the organ system. So the next chapter, it's chemistry. So we have to start with a lecture on atoms and molecules and chemicals. And there's another chapter on molecular biology, which is the study of DNA, which is one of the complex chemicals, macromolecule. And from there, we're starting with microscopic anatomy and physiology. And microscopic means that it's things that you would study under a microscope. So like these cells, we would really need to study those and look at them under a microscope. So cytology, which is the study of the cells, and histology, which is the study of the tissues. Tissues are similar cells with similar function. Okay, so we're going to go from the study of the chemicals to molecules, kind of like synonyms, but we're going to have a discussion on DNA and how it works, and then cells, tissues, and then finally we will get to organology, the study of the organs and the organ systems. So half of the semester we're just working our way up to the organ systems. And the first organ system we will cover is the system of the skin, which is the integumentary system. Now, gross anatomy refers to what can be observed with the unaided eye. So this does not require a microscope. You can just hold the model in your hand, and that's the gross anatomy, what you're looking at with your eyes. So eventually get to that part where we're not looking under the microscope or using slides of pictures that were taken under a microscope. And then we will kind of we'll also have discussions that are very specific, like embryology, for example, which is the study of the development of the embryo, the human embryo in this case. And pathology we'll talk about here and there, which is the study of diseases. So I'm supposed to teach you normal human anatomy and physiology, but sometimes when I want to talk about the importance of why we learn this, I'll introduce some pathology because there's a disease. There's a disease in regard to this particular topic. Directional terms are, which direction are you talking about? Are you talking about top, bottom? So first, when we're talking about these directional terms. We're assuming that the body is in the anatomical position. Anatomical position is when the human is standing, facing forward, with the palms facing forward. So this diagram right here of this girl, she is in anatomical position. She's standing, she's facing forward, and her palms are facing forward. Prone is when you're laying on your belly and you're prone to being like stabbed in the back. Supine is laying on your spine, like laying down. Right and left. So the right, this would be the right side of, this is her right upper arm, her right arm, right forearm, right hand. So it's the, when you're saying the right, it's of that person, that patient, that specimen. It's the right side of that specimen, not your right, their right. So like this is the right eye, and this would be the right side of the right eye for that person. And then the left. Superior, it means above, and inferior is below. Like your superiors are above you. And another synonym for that, cephalic, means toward the head, and caudal means toward the tail. So these are often used as almost like synonyms. Like you could say superior, or you could say cephalic, inferior, or caudal. But cephalic is more like towards your head, and caudal is more towards the tail. So there's a slight difference, but they're used like synonyms in regard to the human. Anterior and posterior. So anterior is the front, posterior is your back. And there are two more synonyms similar to anterior and posterior. Ventral means toward the belly, and dorsal means towards the back. So those are, again, synonyms to anterior and posterior, ventral and dorsal. I think that we use superior and inferior more often than cephalic and caudal, and anterior and posterior more often than ventral and dorsal. But we sometimes see these. We see cephalic and caudal and ventral and dorsal. Now, ventral and dorsal, most of the time we see that is in reference to the spinal cord. And these terms are maybe more commonly used with other animals, but sometimes in reference to the human. Lateral, it means like off to the side, and medial is to the center. So the nose is medial and your ears are lateral. And I like to use the example with the eye. So the corners of the eye are called the canthus. So this is the lateral canthus, while this is the medial canthus. The medial canthus has that little pink fleshy bulb called the caruncle. So this is the lateral canthus, is the medial canthus because it's closer to the center, and lateral is off to the side. And when the person is in the anatomical position, their thumbs are lateral and the pinkies are medial. Superficial and deep. Superficial is like just on the surface, or just under the skin, just, you know, on the surface, while deep is like deep, close to the bone. An example of when we use superficial and deep is in reference to the arteries and the veins. So the arteries are only deep. They're only located deep, close to the bone, running alongside the bones, while veins are both super deep and superficial. Why is that? Why is it that the arteries are only deep while the veins are both deep and superficial? Well, it is because arteries that are carrying blood away from the heart are dealing with a lot of pressure. So if you were to accidentally cut an artery, this blood would just be profusely squirting out, and you could lose a lot of blood in a short amount of time and possibly bleed to death, because a lot of pressure pushing the blood through the arteries. But veins, they return the blood back to the heart, so it's very little pressure. It's so little pressure compared to the arteries. So if you were to accidentally cut a vein, it's highly unlikely that you would lose blood to the point that you would bleed to death. So you don't have superficial arteries because you need to protect them. You need to protect them so that they don't accidentally get cut and severed. So that's why the arteries are only deep. But veins, they're helping return blood back to the heart. It's okay that if they accidentally get cut, because you're most likely not going to bleed to death. And they just help return blood back to the heart. So the more you have of them, it's kind of like the better. Okay, and then we have proximal and distal. Distal, it means like further away, like it's more distant, while proximal is closer to you. So an example of when we use proximal and distal is in regard to the phalanges. So these phalanges in your finger, okay, you have a proximal, a middle, and a distal. There are 3 here, and in the thumb you just have a proximal and a distal phalange, or phalanx if you're talking about just one phalanx. Okay, you can say phalanx or you can say phalange. Okay, so right here we have proximal, distal, and then proximal, middle, distal. And this is true in the hand and in the foot. Now, to differentiate between the fingers, they're numbered. Like your thumb is finger number 1. So you would say first, second, third, fourth, and fifth. And same with the toes. So the big toe is number 1, or the first, and it again only has a proximal phalange and a distal phalange, while all the rest of the toes have a proximal, middle, and distal. So this is 1, 2, 3, 4, 5. So this bone right here, right here in the middle, okay, that's going to be the second middle phalange of the right hand. That's how you would say that. So if I wanted to know, hey, what's the name of this bone right here? This little bone right on the end of my pinky finger, what's the name of that bone? Be specific. You're going to say 5th distal phalange of the right hand. 5th distal phalange of the right hand. All of that is your answer. And then with the foot, the toes, it's the same thing. So let's name this bone right here, or yeah, this one right here. This one right here would be the second proximal phalange of the right foot. Okay, what about this one? This one right here in the big toe, that's going to be the first proximal phalange of the right foot. So this is going to be like test questions, like part of your lab practical. Okay, I'm going to ask, I'm going to show you a picture like this with the X or Y or Z or A, B, C. I'm going to say, give the name of that bone, be specific. So let's start with X. What is the name of this bone? Be specific. That's going to be the second distal phalange of the right hand. Now tell me, what is the name of the bone labeled Z? Be specific. So that's going to be the second proximal phalange of the left foot. So you have to write all of that on the test, okay, when you're answering it, or you say it in a live video exam assessment. Next, we have the body planes, and these can be quite confusing. Students may, they struggle with this. Okay, we have the vertical or longitudinal, that's like up and down, which there are two. There's the frontal or coronal plane that divides the specimen into anterior and posterior parts. So that would be this plane right here. And then we have the sagittal plane, it's also vertical. If it is mid-sagittal, right down the middle, that will divide the specimen into equal right and left halves, right down the middle. And that demonstrates our bilateral symmetry. We have bilateral symmetry. But if it's not right down the middle and it's off to the side a little bit, because you could just cut them like off to the sides, that's called parasagittal. Those are parasagittal sections, and they divide the specimen into unequal right and left parts. Okay, and then the horizontal cross-section, transverse cross-section, divides the specimen into superior and inferior parts. So that was the easiest, that to me is the easiest one. It's just horizontal, transverse cross-section, and that's going to separate the specimen. You're going to be able to see like the inferior or the superior. And then there's also oblique plane, which is at a diagonal. So sometimes they're cut at a diagonal. Okay, next there's the body cavities. There's dorsal and cavity and a ventral cavity. So dorsal, also called posterior, that's going to be to the back. And this cavity is divided into two parts. You have your cranial cavity inside the skull. So it's a big cavity that is created by the skull. And inside the cranial cavity, what's inside of there is your brain. Okay, then you have the vertebral cavity. This cavity is created, all of those vertebra, okay, stacked on top of each other. Each one has a hole in the middle, the vertebral canal. Vertebral foramen creates the vertebral canal. It's just a passageway. And the purpose of that passageway, that cavity, the vertebral cavity, is to house something. In this case, it is the spinal cord. So the dorsal cavity is divided into two cavities. You have the cranial cavity that is created by the skull, inside of the skull, and the vertebral cavity, which is created by the vertebral foramen. When they're stacked all on top of each other, it creates vertebral canal, and inside of there is the spinal cord. Now the structure that separates the cranial cavity from the vertebral cavity, or even could be called spinal cavity because it has the spinal cord, is the foramen magnum. The foramen magnum, I want you to know this, it is the large hole at the base of the skull. So foramen, or you could pronounce it foramen, that is, it means hole. And magnum is just like large, so it's a large hole at the base of the skull. So that structure separates the cranial cavity from the vertebral cavity. This is the foramen magnum. Okay, then we have your anterior cavity or ventral cavity that is anterior, that is in the front. So all of this, the purple, the pink, and the green, all of those cavities make up the ventral or anterior cavity. But you can divide these cavities, you can divide it into 3 smaller cavities. So our thoracic cavity up here in the thorax, what it has inside of it, so it has first everything behind the mediastinum. What is the mediastinum? That word means behind the sternum. Mediastinum is like behind the sternum. So behind the sternum, what do you have behind there? Well, you have the heart. You're going to have a little trachea, esophagus, and the thymus that sits on top of the heart. And then also in the thoracic cavity, the lungs. So that's what's in the thoracic cavity. Then below the thoracic cavity, you have the abdominal pelvic cavity. The structure that separates the thoracic cavity from the abdominal pelvic cavity is the diaphragm. So the diaphragm is a dome-shaped muscle. It goes all the way from the back to the front, and the diaphragm is responsible for breathing. But that structure, that muscle, separates the thoracic cavity from the abdominal pelvic cavity. And then the abdominal pelvic cavity can be divided into abdominal cavity and pelvic cavity. So you can separate those 2 cavities. And what is the structure that separates the abdominal cavity from the pelvic cavity is this imaginary line. It is called the iliopectineal line. I'm going to show you that right now. Well, first I'm going to show you the diaphragm. So this is my model. I call him Tommy. And right here is that dome-shaped muscle, which is the diaphragm, and it's separating his thoracic cavity from the abdominal pelvic cavity. Abdominal pelvic cavity, all this right here. So in your thoracic cavity, you're going to have the heart, the thymus, there's a little bit of trachea that's coming down in here, and the esophagus, which runs behind the heart, and in your lungs. All of that is in the thoracic cavity. And then we have the diaphragm that separates thoracic from abdominal pelvic. Now this is the pelvis. And the top part of the pelvis is called the ilium. The ilium, this is the iliac crest right here. So imagine a line that is traveling from the iliac crest to this iliac crest. So it's going like this. That is the iliopectineal line that is going to separate the abdominal cavity from the pelvic cavity. This is just another model I have. This muscle right here would be the diaphragm, separating thoracic from abdominal pelvic. All this is abdominal pelvic cavity. The purpose of a cavity is the space to house an organs, organ or organs. This is a picture of the diaphragm. It's been taken out of Tommy. So this is just the diaphragm all by itself. So if you were to see this picture on the test, on a live video exam assessment, or in maybe another type of test, that's the diaphragm. This is another model I have. This is Anna, and this is her diaphragm, separating the thoracic from the abdominal pelvic cavity. So I just wanted you to see diaphragm, diaphragm, diaphragm. This is the muscle. Look at it. It's all of this muscle. It's all here. It's all this muscle, super important muscle. And that's the one that if you have not gone jogging or running in like a really long time, and then you decide, oh, I'm going to go for a little jog, and you start jogging, and then all of a sudden you start feeling this like a stitch in the side of your, like the side of your lungs, like, oh, like a little, kind of like a sharp stabbing pain. They call it like a stitch. That's your diaphragm. Your diaphragm's like, what are you doing? What's happening? So it's a big muscle, and it needs all of those electrolytes to work, so it's not used to this, okay? It's not in shape. It's not a condition for this. So you're going to feel a couple stitches before, you can run past that. You keep jogging more and more and more and more, eventually you don't get those anymore. But you might need, I was going to tell you that what you need is like Gatorade or pickle juice to help get rid of that. Or just keep running and eventually it goes away. Okay, so let's talk about what's inside the abdominopelvic cavity. So I like this picture. So imagine at the top of the pelvis here, we have kind of like a line, the iliopectineal line. But in the abdominal cavity, we don't need to name all of these organs. We're just going to say the guts. What's in the abdominal cavity? That big, huge cavity. It's a big space. What's inside of there? The guts. Okay, all your guts. Okay, that's going to be the stomach, the liver, the pancreas, the gallbladder, small intestines, large intestines. Even you're going to have the kidneys, the adrenal glands, all your guts. Now in the pelvic cavity, you're going to have the rectum, the very last part of the large intestine or colon, urinary bladder, and then your reproductive organs. So if you're female, you have like the uterus and the vagina, and if you're in the ovaries, and if you're a male, you're going to have some glands. There's like the seminal vesicle, the prostate gland. So that's what's in the pelvic cavity. Okay, so now we are going to talk about the body regions. And these are all the body regions that I want you to be able to identify and to know for this first exam. So the cephalic region, it refers to the entire head. Occipital, it's the back of your head. It's back here, the back of your head. Parietal, it's here. It is like lateral side, so you have a right and a left parietal region. Temporal, you think of like your temple. This is your temple. But the temporal region is all of this region. It is above the ear, behind the ear. It's not just here. It's not just the temple. It's the temporal region. Frontal is your forehead. Zygomatic is the cheek. Not the cheek, but like your cheekbone. The zygomatic bone is right here. All this. Orbital, like you have the orbit around your eye, the orbital region. This is zygomatic. This is orbital. Auricular, around the ear. Otic, like the otoscope is the scope that goes in your ear, like you're trying to look at the eardrum, the tympanic membrane. So this is the otic, otoscope, otic region, or auricular. Auricular meaning your outer ear, your satellite out here. Oral is going to be the mouth, the region of the mouth. Nasal is the region of the nose. Mental, so you have this area right here that is called the mental area. This is like where you put your finger right here and you think mental thoughts. That's the mental region. And cervical is the neck. So which was the name of this area right here where the star is located? What was the name of that area? Okay. The scalp refers to, it's not really a body region. The scalp refers to the skin on the head that has hair or is supposed to have hair, should have at one time had hair. So it's not really a body region. It just means the skin on your head that is supposed to have hair. Okay. The vertex, it's the tippity-toppity part. Right here is a good picture of it. This yellow part. The very tippity-toppity part of the head. Like tippity-top. While the crown has couple of different definitions. The crown can just be your skull, this whole skull cap, like the skull cap, like the top of the head, or it could just be this back part, the crown, the back part, the crown of the skull. So that's kind of confusing because it has multiple definitions. I guess it would include the vertex. If it were my definition, it would be all of this. This is all the crown right here. Nuchal is the back of the neck right here, nuchal region. Okay, the torso or the trunk, it's like if you just chop the head off and the upper appendages and the lower appendages. So you're just the torso, just this is also referred to as your trunk. Acromial region is the shoulder. Thoracic, all of this kind of like in orange, all the thoracic region, everything above the diaphragm. Remember where we talked about behind the sternum, which is the mediastinum, and your lungs, all that thoracic. Clavicular is up here where the clavicle is located. Clavicular. Pectoral is chest, so all of this area would be the pectoral region. Sternum or sternal region, where the sternum is located, right here, this bone. Mammary is the breast area of the breast, and axillary is your armpit, the axilla or axillary region. Okay, and then the abdominal region right here, this in purple, it can be divided into 4 different divisions, quadrants, or it could be divided into 9 sections. So let's start with the 4. So if we just make a cross down this, to divide our abdominal region, then we have the right upper quadrant, the left upper quadrant, right lower quadrant, and left lower quadrant. And this is one way that they really truly divide up the abdomen in the medical world. Sometimes when you're reading an x-ray, it'll actually use this abbreviation RUQ, LLQ. You're like, what is LLQ? What is that? It means left lower quadrant. So these abbreviations and terms are the way in which you can divide up the abdomen, and they are going, you're going to see them again if you're in the allied health profession, which most likely you are. So those are very common ways. Like you might say, the patient complained of pain in the entire RLQ, like all this area here. Okay, now another way to divide up the abdomen in kind of more defined specific regions, right where the belly button is the umbilical region. So right around here. So there are some medications, some injections that they want you to give them within the umbilical region. And then above the umbilical region, we have epigastric. This area, everything happens right here in the epigastric region. This is where the stomach and the pancreas and the liver and the gut, all these things kind of come together right here. So it's a frequent area for patients to complain of pain. So if you were to ever say, can you point with one finger the source of your pain, because they have like abdominal pain, a lot of times our finger just goes straight to that epigastric region right there, because there's a lot of stuff going on right there, and gallbladder pain will be felt there. So That's the epigastric. And then below the umbilical region, we have hypogastric. It's kind of like a little bit misnamed because hypogastric literally means below the stomach, but it is not below the stomach. The stomach is way up here. So it's kind of like way, way below the stomach. But it's referred to as hypogastric region. It's kind of like misnamed. Somebody didn't name that right. Now on either side of our umbilical region, we have the right lumbar and the left lumbar. Now most of the time when you think of lumbar, you think of lower back. But if you take your hands from your lower back, from your lumbar region, and just kind of bring them around to the front, can't really show you in my picture, bring them around to the front, it's right there on either side of your belly button. So if you just kind of like move that lumbar region to the front, then you have your right lumbar and left lumbar. But if somebody says it's the right lumbar, I would think of the right lower back. I wouldn't think of abdominal. I mean, this front part. So I'd be like, can you maybe specify, are you talking about the back or are you talking about the front? You talking about lumbar or are you talking about over here? So that's confusing too. And then we have on either side of the epigastric region, we have the right hypochondriac and we have left hypochondriac. Hypochondriac, so that means below the cartilage. And this right here is cartilage. It's the cartilage between the sternum and the ribs. So that is cartilage. So finally, they sort of like named it right this time. So you have the right hypochondriac and the left hypochondriac, which is just below that cartilage of the rib. Just like feel the bottom of your ribs, and that's going to be the right hypochondriac and the left hypochondriac. Okay, then on either side of the hypogastric, we have the right iliac region and the left iliac region. So down there in that right iliac region, that is maybe where somebody might feel pain if they were starting to have some appendicitis. Right over here. Okay, so this is all the areas. So sometimes you might, when might you use that? You might talk about like, okay, well, I want you to give the injection in the umbilical region. Like the insulin injections are usually around within 1 inch from the belly button within the umbilical region. And sometimes you might, you might put the lantus in the right lumbar and the humerus in the left lumbar, you know, on the right, on the left. Or if you're just describing the pain and you want to be more specific, they are complaining of epigastric pain, like pain from the epigastric region, instead of like right lumbar, right upper quadrant, left upper quadrant. You're like, no, it's coming from right here, epigastric. So sometimes you use the 4 quadrants to describe the abdominal region, and sometimes you use this 9 quadrants, these more specific regions to describe the abdomen. Okay, so I might have it might look something like this on the test. I'll say, well, just tell me how would you name this region number 12? What abbreviation would you use? And like, what is the abbreviation and what does it mean? And then what is the specific region number 7? Okay, now the posterior part of the thorax, of the trunk or torso. So the entire back is the dorsum. All the back is the dorsum. The scapular region, that is where you have your this shoulder blades, that's the scapula. So this is the scapular region. The vertebral region, right down the spine here, where you have your vertebra. So the vertebral region. Lumbar is what I was telling you earlier. You know, most of the time when you think of lumbar region, you think of this lower back here. Oh, my lumbar region. And the sacral region, so the sacrum, you have the vertebrae are all, divided into sections, but this part of the vertebra is the sacrum. And then the gluteal region is the buttocks region. So once you know all of those sections, and what name the section, this region, body region labeled X. It's kind of like this whole region right here. What about this little bitty triangular region right here? What's the name of that region? Okay, so when you were a kid, you referred to this as your arm, but not in anatomy and physiology. So in anatomy and physiology, this is the arm up here, and this is the forearm. And so when we refer to this entire structure, it is your upper appendage or upper extremity. So this whole thing is the upper appendage or upper extremity. But if you say arm, that's just this. So brachial is arm, and antebrachial is forearm. Cubital refers to the elbow. Antecubital is the inside of your elbow. And this vein right here, that vein right there, where they draw blood, is the median antecubital vein. That is the name of the vein because that's its location. Median antecubital vein right there. Olecranon, it's the back of the elbow, just the back, while cubital is like the whole elbow. And then carpal is your wrist. Manus is in reference to the hand. Palmar region, the palm of the hand. The phalanges or the digits are your fingers. And pollex is the thumb. So I want you to know the name, all these proper names of these body regions and what they refer to. So like if I say, what's the olecranon? What is the region behind the elbow, the back of the elbow? What's that called? I want you to be able to say olecranon. Or what is the region of the elbow? So that's Z. So Z is, what is the name of like the entire elbow region? Or it could be like, what is the name of the back of the elbow? And then X gives the name of the region indicated by X. What's the name of that region? Okay, so when you were a child, you referred to all of this as your leg. This is not the leg. This is your lower extremity or lower appendage. So what is the leg? Just this right here. Just this right here is the leg. This is the thigh, and this is the leg. And the entire structure is not the leg. The entire structure is the lower appendage or lower extremity. I want you to know all these areas. So coxal is the hip, the body region that is the hip right here. Femoral is the thigh. So all of the thigh is the femoral region. Inguinal. Inguinal, I call it the thigh pit. Do you see this white line right here? That's the inguinal region. It's like your inguinal area, the groin, thigh pit. It's like where the pelvis meets the thigh, the inguinal region. Geniculate is the area of the knee. And if you look up the definition geniculate in the dictionary, it means to bow before the king. And wouldn't you get on your knees if you were bowing before the king? Popliteal is the back of the knee. Patellar is the kneecap. Crural is this shin area. So the crural region is like the shin, the front, anterior part of your leg. The fibular or perineal, that's what I don't call it fibular region, I call it the perineal region. It is the lateral side of the leg. So back the lateral sides of the leg. There's a muscle there. There's two muscles. Perineal region. Calcaneal is the heel of the foot. Pedal means foot. Hallux is the big toe, kind of like your thumb is pollex. The big toe is the hallux. Plantar is the sole of the foot. Pelvic region, so like all of this where the pelvis is located, this is all the pelvic region, but maybe when they're kind of like right below the belt, that could also be considered the pelvic region. But when somebody says pelvic region to me, I think of all the pelvic region, not just right here. And then the pubic is the area where you have your genitals. So this is the pubic region. Okay, looking at the back of your lower appendage. Again, the femoral region is the thigh, popliteal behind the knee, the back of the knee, peroneal or fibular, which is the lateral sides of the leg. Sural means calf. So sural is all this behind the back of the leg, which is the big bulky calf muscle. The sural region. Calcaneal is the heel of the foot. Pedal is like in reference to your whole foot. What was the term for your entire hand? All of the hand. What was the name of that? The manual region. So this is your pedal. The foot is your pedal. And then the sole of the foot is the plantar region. Now I also want you to know what is the volar region. So the volar region is both the palmar and the plantar because they have a lot in common. They are very similar, the skin of the palmar region and the plantar region. So together they are the volar region. Okay, if you were paying attention, let's see. What is the name of this little region behind the knee? These are like example test questions. Okay, so the pubic region, it is a diamond-shaped region that it goes from, let me see if it's on the next slide. The pubic region is a diamond-shaped region that goes from the pubic symphysis. It's a diamond-shaped, okay? It's bound in front of the pubic symphysis and back by the coccyx and on the sides by the thighs. So this diamond-shaped region here, which is your pubic region, genitals, the privates are here in this area. So from the pubic symphysis, this joint right here between the two pelvic bones is the pubic symphysis. I want you to know that. That is going to be on multiple tests, okay? Not just the first test. So the pubic symphysis, what's the name of that joint between the two pelvic bones? Pubic symphysis, okay? It goes all the way to coccygeal region, so that's the pubic region. The perineal region, perineal or perineum. Okay, well there's two definitions. One is the same as the pubic region. It's the same diamond-shaped region. So if you're a nurse and you're doing a okay, so if you're a nurse and you need to wash the genital area, we refer to this as a perineal wash. a perineal wash. Okay, so we're talking about like the entire pubic area. So that is one way to define the perineal or perineum. But another definition of the perineum is the doctor's definition, the physician's definition. And that is a smaller region that is bound in front by the vagina and in back by the anus. So it's just this small little region right here from the vagina to the anus. And for males, it's from the scrotum to the anus. So it's just kind of like a smaller little area. Now, why is this a different definition according to physicians? Well, one example is when doctors need to perform an episiotomy. That is when they actually have to cut, or they don't have to, but they do cut this perineum to give more space for the head of the baby, okay, like during birth, okay, during delivery of the birth. So this baby's coming out of here and all this area is going to rip. It's just going to rip. I mean, sometimes that does happen. It's actually quite frequent, especially with the first baby. And if the first baby is coming a little like quickly, it doesn't give time for this to kind of stretch. And so the baby's just coming out and rip away. And sometimes it just rips it all jagged and it comes all the way down and rips it all the way to the anus. Okay, and that's called a 4th degree laceration when there's a cut or a rip that goes all the way and cuts this muscle, the external voluntary anal sphincter. Okay, now that's bad because if that does rip, then while it is healing, you're not going to be able to control that external sphincter, and that's not going to be good. Like, you're going to have to wear a diaper. Okay, can't control that sphincter, that would be pretty bad. So what doctors will do is, you know, they've had a lot of experience delivering babies, and they've seen this perineum rip a few times on occasion. And so they're like, you know what, it's gonna rip. Like, they can tell because of their experience. So then they have to decide if they're going to do a medial episiotomy, or if they're going to do a paralateral or mediolateral. I call it paralateral episiotomy. Now, what is the difference between those two? If they feel like, okay, we just need a little bit of room, just a little bit of space, they'll do a medial because it's supposed to heal faster. It's easier to stitch up. It's supposed to heal faster. But if they think that they need a lot of room, and if they do a medial episiotomy, it's going to go all the way back and cause a 4th degree laceration, they'll say, no. We don't want to cut. We don't want the anal sphincter to rip. So we're going to do a paralateral episiotomy so that it rips that direction and not the anal sphincter. So if you're the woman in this situation, you would hope that the doctor had a lot of experience and knows what they're doing, and you would not want to have that anal sphincter rip. That would be the last thing that you would want. So you would hope that they would perform a paralateral. If that were to possibly happen, you would want to prevent the 4th degree laceration and hope that your doctor knows, your obstetrician knows to perform a paralateral episiotomy. That's what I would hope for if it were me. And I had the discussion with my doctor before delivering my baby. But, you know, I had it all planned out. Everything was supposed to go according to plan. But in the end, I had to have a C-section. So I didn't get to do that. Anyway, all that discussion about episiotomies and mediolateral and paralateral, these are good example of when and how we use this terminology anatomical terminology. We're talking about the type of cut, the type of incision, and using that terminology. So this is going to be something that it's on the test. Everything that I present to you in a video is all testable material. So I want you to know this. I want you to know what is an episiotomy. That is when you cut the perineum during delivery, so to prevent ripping of this tissue, because that takes longer to heal. So this is supposed to help it heal faster. You can stitch it easier. And also the paralateral would help prevent a 4th degree laceration, which would be terrible. Okay. Now, I don't want you to get this mixed up with the peritoneum. So you have a perineum, which is like that little area. Okay, this little area is the perineum. I don't want you to get that mixed up with the peritoneum. So the peritoneum is not a body region. It is actually going to be on my next video. It is a serous membrane that surrounds your gut. So all this blue membrane here, it's the serous membrane that surrounds your gut. So I don't want you to get those two mixed up. So that's why I kind of introduced it right here. The perineum is an actual body region, while the peritoneum is the serous membrane around your guts. And the peritoneum, it has a T in it. Okay, that's the serous membrane all around your guts. What is the name of this region right here that is going from the scrotum to the anus? What is the name of this joint right here between the two pelvic bones?